So, the brand new standards of care from the American Diabetes Association are officially out, and let me tell you, this is a big deal. We're talking about one of the most significant shifts in how we approach diabetes and overall health that we've seen in years. It is packed with some real game-changing updates, so today we're going to break down the key takeaways that you absolutely have to know. Let's get right into it.
First off, you've got to understand these are not just some minor tweaks to the old rules. This year's guidelines signal a massive shift in thinking. For the very first time, they're officially bringing the management of diabetes and obesity under one roof, treating them as what they are, deeply interconnected cardiometabolic diseases. This really does mark a whole new era of care. And this quote from the ADA's Chief Scientific Officer, Dr. Samar Hafida, just nails the new philosophy. You see those keywords? Unified, proactive, understanding the biology. It's all about getting ahead of the problem and treating the whole system, not just the separate symptoms. Okay, so proactive sounds great, right? But what does that actually look like when you walk into a doctor's office? Well, it all starts with one simple idea: catching things way sooner. And that means earlier and much more comprehensive screening. This brings us to a super fundamental question, one that affects millions of us. When should you actually get tested? For years, the answer was, well, it was kind of complicated. It was based on this long checklist of risk factors. But that's all about to change. And here it is. The new rule is wonderfully simple. The ADA is now recommending universal screening for every single adult starting at age 35, period. Doesn't matter what your risk factors are, it's a clear, simple directive designed to find problems much earlier.
And hey, this isn't just a suggestion floating around, it's right here, laid out in black and white in the official ADA tables. The recommendation is now simple and direct. Screening for all adults, it starts at 35.
Now, being proactive doesn't just stop with your blood sugar. The guidelines are also putting a huge emphasis on testing for related conditions, like peripheral arterial disease, or PAD. This is a circulation problem that can have really serious consequences. They're now recommending a screening for anyone with type 2 diabetes who's over 65, has other heart issues, or is having foot problems. Why? Because catching it early can literally be limb-saving.
All right, so let's say a diagnosis is made. What happens next? This brings us to the next big shift. It's not just about finding it early. It's about using much smarter technology and more targeted treatments once you do.
This comparison right here perfectly illustrates one of the biggest leaps forward. We are finally moving away from that old, reactive world of painful finger pricks. Instead, we're moving toward a new reality of continuous, real-time data that can empower you like never before.
Now, for anyone who's not familiar, a CGM is basically a small, wearable sensor that automatically keeps tabs on your glucose levels 24/7. It gives you this constant stream of feedback, showing you exactly how the food you eat and the activities you do affect your body, right in the moment.
And this is the crucial part. The new recommendation is that anyone on insulin should be offered a CGM. But, and this is a big but, the guidelines also recognize that even people who aren't on insulin can get some incredibly powerful insights just by seeing their own glucose data. The guidelines are getting a lot smarter about medications too. Take a look at this table. It points out some really common blood pressure meds that can accidentally cause weight gain. But then it gives doctors a list of better alternatives that are just as good for your blood pressure, but without that unwanted side effect. It's about making smarter choices.
And speaking of blood pressure, this one is huge. For the longest time, the target was to get your systolic pressure, that top number, below 130. Well, the new guidelines are getting more aggressive. The new goal is to push it down below 120 whenever it's safe to do so, to really cut down the risk of heart attack and stroke.
You know, all of this, it points to a much bigger idea, the next major theme in these guidelines. We're finally looking at the whole person and recognizing that your health is so much more than just a single number on a blood sugar meter.
I love this quote because it really gets to the heart of the matter. The message is crystal clear. These powerful new drugs, like the GLP-1s, they work best when they're paired with intensive lifestyle changes. It's not one or the other anymore. The real magic happens when you do both. And they're also getting way more specific with weight loss goals. It's not just lose some weight anymore. Now we have these clear, evidence-based tiers. A 5% loss? That's great for general health benefits. Got related complications? The goal is more like 10%. And for some people, the data is showing that a 15% weight loss might be what's needed for those major health turnarounds.
Now, Let's talk about something that's just as important as your physical health, your mental health. This data is so important. It shows that about 30%, nearly 1 in 3, of people living with type 2 diabetes also struggle with depression. The new guidelines are saying this is a connection we just can't afford to ignore any longer.
So to finally tackle this head-on, the guidelines are now formally calling for annual screening for a whole range of behavioral health issues. We're not just talking about depression, but also anxiety, the very specific fear of low blood sugar, and that general emotional burden that we now call diabetes distress.
So after hearing about all these changes, you might be wondering, what's the big takeaway? Well, this last section is all about you. It's about empowering you to take a much more active role in your own health using all this new information.
Let's start with this number, because it is absolutely staggering. According to the ADA, over 85% of all diabetes-related amputations are considered preventable. Let that sink in. Preventable. This just shows how incredibly high the stakes are for proactive, engaged care.
Okay, so here's your action plan. Here's what you can do right now. 1. Start checking your blood pressure at home and aim for that new lower target of 120. 2. Ask your doctor about new tech, specifically a continuous glucose monitor. 3. If you are ever told you might need an amputation, always get a second opinion. And 4. Talk to your healthcare team about intensive lifestyle coaching, which is now more strongly recommended than ever before.